Assalamu alaikum. Clinical station, thyroid examination. Two types of question statement may be given. One is look at the neck and to the relevant, or look at the neck and assess the thyroid status of this child. So the first question is look at the neck. So wash our hand in introduction, and then sterilize hand and smile, and getting an introduction in this way that good morning, my name is Dr. Roxana, one of child doctor here, and are you Ahmed and Ahmed's mom, and thank you for coming. And now explaining our rule today, I like to examine your child's neck, and also it involves his gait. Is it okay? And then making some rapport. That's why we can get information regarding any hoarseness of voice present or not. And then inspection, general inspection, overall inspection for any dysmorphic feature, what is the dimension, what is the pubertal status, any eye sign present or not, any device, parental height. And then local inspection of the neck. Inspection, any visible swelling. If it is swelling, is it central or at the side? Any visible nodule present or not? Any scar mark present and or not? And ask the child, and we have to examine the thyroid gland or neck in the sitting on chair, and drinking water, inspection, and also in the palpation. And if there is and then if there is any thyroglosal cyst, then we will ask child to stick tongue out. For this reason, if the cyst will rises above with the tongue out, it is thyroglosal cyst. And then inspection of the oral cavity for any ectopic thyroid gland or the high thyroglosal cyst position. And after inspection, palpation from the behind with three finger manner, and from the behind we will palpate on the side of thyroid gland, and we will palpate for is there any nodule, is any cystic pressure or not, is it painful or not. And then we will offer to drink water to make sure it's thyroid gland. And after this we will also palpate for cervical lymph node and also carotid pulse. And then we will come forward for tracheal, is there any tracheal deviation present or not, and then percussion over to sternum for retrosternal thyroid. And then auscultate with the bell of the stethoscope, and we will advise child to hold breath in expiration. And if thyroid bleed or excess blood is present, we will ask the child to hold the breath, and then we will looking for thyroid bleed. And then after that, this local examination, we will go for thyroid status examination. So in the hand, is this warm hand or cold hand, if there is any roughness of skin, and then we will tell the child to outstretch the hand for the tremor and the pulse. And in the pulse, if this is high volume pulse, which may present in the hyperthyroidism. If it is high volume pulse, so to make sure it's collapsing pulse, and to make sure it's collapsing pulse or not, we have to do the examination for the collapsing pulse. And then offer for blood pressure measurement and axilla for the tenor staging. In the eye for exophthalmos, we have to examine the eye from the above and for the side. And for lid retraction and lid break, for this reason we have to, for the leg delayed movement of the upper lid in the down gaze. And we have in these cities we have to measure the external ophthalmoplegia. For this, these two types of movement, we can do the H-type movement for seeing the external ophthalmoplegia present or not. Here we are also looking for the conjunctival congestion edema. And then upper lid for proximal myopathy. Proximal myopathy, the advice may be like this: raise your arm above and don't let me bring it down. This is the proximal myopathy, and therefore proximal myopathy of upper limb, and the proximal myopathy for lower limb we can do the Gower sign. And then examination of the reflexes. Usually in hypothyroidism there is slow relaxation of the midriff, and in case of hyperthyroidism there is hyperreflexia. However, in case of hypothyroidism, if it is central hypothyroidism, hyperreflexia may be present. And then we can ask for the gait if time permits. Otherwise, we can see that to complete my examination, history, vital sign, pubertal staging, height, weight plot on child, and also gait of the child. And if there's no time, so we can also say that we also want to see the PTBL lexedema present or not. This is all about examination of the thyroid gland.